Meniere's disease, once treated only by severing a person's hearing for good. Now, thanks to a surgeon right here in Denver, patients are getting the help they need.
Tom Brown is getting a routine follow-up exam. It's been a year since his surgery for Meniere's disease, 2.5 years since the first violent attack came on without warning.
It was early afternoon. I was with a friend and an attack came on. Became extremely dizzy, falling over chairs, objects. Tried to regain my composure, and it was as if I was drunk. One moment you will be fine. 5-10 minutes later, you'll be in a full-blown attack. You'll have difficulty standing up. You'll be bouncing off of walls. It's very difficult to describe to the normal person.
Meniere's disease is, in fact, a buildup of fluid in the inner ear that causes pressure, similar to glaucoma in the eye. The major symptoms victims experience are vertigo, hearing fluctuations, a feeling of pressure in the ear, nausea and vomiting, as well as a ringing in the ear or tinnitus. The problem is there is no set pattern with this disease. So as Tom learned, diagnosis can be a long time in coming.
This type of disease can happen to anyone at any time in life, and that if they have that kind of disease, to seek out professional assistance and just persevere, keep pushing along and say, I have a problem, solve my problem.
I think it's a very difficult problem to live with, and it's difficult because the patients don't have the abnormalities present all the time.
Dr. Ehrenberg has been help for Tom and many other Meniere's patients. Fact is, he's one of the leading medical experts on the disease and designed the implant for treatment. It's called an inner ear valve shunt, measuring no bigger than a dime, but when surgically placed within the inner ear can bring great relief.
What we're trying to do is to restore the normal fluid dynamics in the system by providing an escape valve shunt that will allow the excess fluid under pressure to go from an area where it's causing problems and symptoms to an area where that fluid won't be damaging anything.
I no longer have the attacks that would come on. It's business as normal, and I work for myself. And it's just changed my life 100%.
Tom still has some hearing loss from his early attacks, but even that appears to be improving. And while there's no specific cause or cure for Meniere's, treatment is making this disease much easier to live with. Barbara Berlin, Channel 2 News, cover story.